Show podcast station. And we're bringing you daily health and information, where daily health is viewed as an ever changing reality. Welcome. This is Daily Health. All information and resources are based on the opinions of the host, unless otherwise noted. All information is intended to motivate, encourage, and inspire positive change and a healthier lifestyle. Now, this podcast contains some quotations, images, and excerpts from copyrighted material. These uses fall well within the copyright doctrine of fair use. Fair use refers to the right to reproduce, use, and share. Hi, and welcome. This is your Daily Health. I am your host, Tony Williams, and you are listening to On One Radio, the talk show podcast station. Now, when we think about daily health, we think about everything from top to bottom, our head, our hearts, most of our internal organs and everything like that. But when we think about the head, we don't think about what's going on in our head, anxiety, depression, and things of that nature. And I wanted to talk to you all today about pretty much keeping that end of the spectrum intact, try to maintain and move forward, because your mental health is definitely a part of your daily health. Now, with everything going on in the news, and people have anxiety already, anxiety, depression, among other things, you want to know, how the heck can I keep everything mellow, kind of across the board, considering what's going on, especially with the COVID-19 epidemic? Now, this is what today's show is going to be about. And I'm going to answer a couple of questions, because I've been asked a couple of questions about how do you keep it together? How do you not completely lose it? How do you keep your anxiety and everything intact? Well, there's a lot of uncertainty right now surrounding the coronavirus, but by taking a step back to look at the facts, you'll be better able to plan and stay more sane through it all. I'm telling you, we have to, because I know this is something hard. Now, taking a step-by-step approach to dealing with the coronavirus pandemic can actually help you calm all the anxious thoughts in your head. Because once that little rat get on that hamster wheel in our head, and it just keeps turning and it kind of creates some other unnecessary stress and anxiety. Now, it's perfectly human to be concerned about your health and safety during the first major pandemic in recent history, with the cases of new coronavirus racing across the globe and increasing rapidly in the United States, school closing and events being canceled, more people going into enforced or self-quarantine, and shift workers suddenly out of a job because their industry relies on the presence of other people, and it can be hard not to stress over what comes next. But if your concern snowballs into excessive worry or panic that prevents you from carrying out your daily functions or interferes with the relationships at home, work, school, or elsewhere, then your state of mind may be worth some closer attention. Now, I suggest a licensed counselor, because that can help. Being able to vent and talk about it and get the opinion of a professional can really help. And so I implore all of you to do so if you need, especially when you have anxiety and other mental health issues. And I know, but with the uncertainty of this crisis, we've seen increasing levels of anxiety in people who are typically able to cope with challenges in a pretty decent, level-headed manner. And some people have started fighting with family members who disagree about how to respond to COVID-19 and the name, and everybody's just kind of panicked and kind of running around right now kind of like chickens with their heads cut off. But it's the fears. They have trouble turning off the news or are avoiding it altogether. They're letting their worst fears guide them instead of their best thinking. Now, I want to help people figure out how to stay thoughtful, calm, and able to solve problems as the news about COVID-19 changes daily. And sometimes, hourly. It's going back and forth. It is ever changing because of course this is something that we're not prepared for, but there are still things we can do to help each other better cope. Now, one of the questions I've encountered is how do I know if anxiety about the coronavirus, if I have it, how do I know? Well, if you're worried excessively about the coronavirus disease and are feeling a lot of fear that you find difficult to control, then you may be experiencing anxiety. You may have had some of the following symptoms: fatigue, irritability, trouble sleeping, rapid breathing, trouble concentrating, panic attacks, obsessive thoughts about getting sick. Now, one of the other questions is, what should I do if the nonstop news about COVID-19 is making me anxious? Well, if you're feeling anxious from reading or listening to the constant coverage of COVID-19, chances are you're consuming too much of it too often. Consider selecting 2 or 3 reputable sources to gather your information from and aim to read, listen to, or watch them just once or twice a day. So you may have to pull back a little bit from it. You may want to select one national or international news source. So that way you can get your information and stay up to date on what's going on. And I would suggest one of the best resources is sign up for the Centers for Disease Control and Prevention newsletter, and you will get a lot of your information there. Now, another question is, what can I do right now to manage my COVID-19 anxiety? Well, one of the best ways to manage anxiety is to aim actively, separate your most rational thoughts from your worst fears about COVID-19 virus. Take time to gather the necessary facts about the disease, such as via the CDC's information on symptoms and preventive measures. Stay up to date on steps your local and state governments are taking to prevent its spread. Jot things down if it helps. Then you can also create a step-by-step plan that addresses those facts to keep you and your family healthy. Focus on the problems you can solve rather than the what-ifs, as well as how you can contribute to the overall health of your community. It's kind of taking your mind off of one aspect of it and kind of breaking it down into smaller pieces that you can really handle and think through and can actually do something about. So, should you talk to a therapist about your COVID-19 anxiety? If you're experiencing symptoms of anxiety that interfere with your daily life, work, or relationships, then therapy may be useful to you. Getting your fears about COVID-19 off your chest in a non-judgmental space can help you think more clearly when devising a fact-based plan for taking care of yourself and others during this pandemic. Therapy can also help you build communication skills that can assist you in navigating conflicts with your family members that could arise due to COVID-19 anxiety. Given current travel limitations and the need for social distancing, in which you should stay 6 feet away from other people, ask your current or potential therapist if they offer phone or video sessions. So that'll take a little bit off you as well. Now, another one was, how can I worry less about missing work if I'm quarantined or my kids' school is canceled and I need to stay home with them? Well, if lockdowns or school cancellations have been or may be enforced to where you live, making going to work impossible, consider what you'll need to do to put your work plan into place. Stay up to date on the proposed Congressional Families First Coronavirus Response Act and whether your employer, and thereby you will be eligible for aid under the bill, which will provide you paid sick leave to some employees, expand food assistance and unemployment benefits, and require employers to provide additional protections for healthcare workers. Now, separate from the bill, talk to your employer about telework and sick leave policies. Ask them what their plan is for employees who need to be quarantined. Know your rights as an employee and consult with your human resource department or get legal assistance if needed. If legal help is cost prohibitive, consult with the American Bar Association to see if you qualify for free or pro bono assistance. So hopefully that puts you guys at ease on that end of it. Now, the next one is, how do I handle feeling lonely or anxious if I'm isolated by teleworking orders or being officially quarantined? If you live alone or are worried about feeling lonely or isolated while various quarantine measures are in place, it can be useful to make a plan for your mental health. Ask friends and family if they're willing to schedule time to talk on the phone or online. See whether the organizations or religious congregations that you belong to are hosting virtual meetings or services. And if you have a therapist, ask them whether they offer phone or video sessions for their patients. Creating a plan in advance can help you feel in control of your circumstances if you're quarantined, and may even make the time in isolation more enjoyable. Now, how can I reduce the stress of working from home while my kids are also forced to stay home from school? Because there's those parents out there that are probably about to pull their hair out right now. Please don't. Don't do it. Your hair is gorgeous. Leave it in. Now, if you have to telework and don't have or can't afford childcare, it's important to be realistic about how much work you can get done. Also, try not to be self-critical if you can't provide enriching activities for your kids all day long. These are unusual circumstances, and anxiously worrying about maximizing your day will probably only interfere with your work and promote conflicts with kids and other adults. Consider allowing more screen time than normal to keep your kids occupied. Whether it's something educational, something really fun that they really like, to keep their attention and hold it. Or create a schedule with different hourly tasks that mimics their school schedule. If you have more than one child and they're prone to fighting and your place is big enough, keep them in separate rooms or schedule times when they're together and apart. If your children are older, ask them for ideas about how they can have fun or complete school assignments while you get your own work done. So hopefully that helps the parents in that aspect. Moms and dads and caregivers, you've got this. You can do this. You can get through this. Now, one of the other questions was, what can I do if my spouse, a family member, or close friend is experiencing anxiety about the COVID-19 virus? Now, the best way to help loved ones deal with COVID-19 related anxiety is to first take steps to manage your own anxiety. So rather than arguing with them about the facts, consider sharing with them the thoughtful measures you're currently taking to stay healthy and worry less, and what news sources you're using to stay informed. And ask them how you can help, as well as encourage them to talk with a mental health professional if their anxiety is getting in the way of daily functioning. So there's always something positive that you can do to assist not only yourself but others. Now, what should you do if your anxiety about COVID-19 is affecting your kids? Well, taking steps to manage your own anxiety is always the best way to help your children not panic about COVID-19. It's being a model of calm and reason, and it is ultimately more effective than anxiously reassuring them that everything is going to be okay. If your children are old enough to know about COVID-19, ask them what they know about the disease and correct any false assumptions or myths or anything that they may have in mind. Then talk about your family's plan for staying healthy and safe, asking your kids if they have any input of their own, and thanking them for doing so. So hopefully that will help as well. Now, there's also some out there that are worried about their underlying health conditions that makes them more susceptible to COVID-19 virus. And they want to know how they can worry less as well. Well, as before, gathering the facts about COVID-19 prevention both in general and in relation to your conditions can help you stay focused on problem solving rather than worrying about worst case scenarios. At the moment, people with underlying health conditions in most parts of the country are being encouraged to self-isolate. And it's a good idea because it's just protecting yourself. You have to take a little bit more thought into protecting yourself a little bit more because you may be more at risk. And you can also talk to your primary care physician or the specialist treating your condition to see what you should do if you have a fever or experience difficulty breathing. Two key symptoms of the virus, as well as what additional preventive measures you can take for your specific situation. And be sure you have an ample supply of your prescription medications. A lot of doctors right now will be more than willing to automatically give you an updated refill. Just give your healthcare professional a call, and that should ease your mind some and ease your worry. Now, if you're employed, of course, know your rights as an employee as they relate to teleworking and sick leave. Also, talk to friends and family members about your concerns and offer them suggestions on how they can support you if you must self-quarantine or you become sick. Now, if you have a mental health condition and you have a question, what can I do to prevent COVID-19 anxiety from making it worse? Now, see, I'll be honest with you because I have my own anxiety issue. And so for me personally, I have had to put in a little more work, just like I'm asking you guys to as well. So this will benefit you as well as me and everyone else who's in that same boat. Now, if you have a diagnosed mental health condition, such as anxiety or depression, it can be helpful to consider how societal anxiety about COVID-19, as well as being isolated, can increase or worsen the symptoms of your condition. If you have experienced depression, for example, being forced to reduce contact with others may cause a dip in your mood. Think about what extra support you may need to keep your mood and spirits lifted and to keep functioning. Now, during these times, and put that support into action before symptoms worsen. This might include meeting with therapists or psychiatrists, talking to friends and family more frequently, refilling medication prescriptions, increasing healthy habits like exercising and making sure you're getting adequate sleep. Those things will help kind of ease that and hopefully kind of help balance out a little bit. Now, I have one last question that I'd like to go over. What do I do if I'm worried about racial profiling because of the COVID-19 virus? If you have already experienced or are worried about racial profiling due to COVID-19, consider creating a plan to help you feel safe and supported. Schedule times with loved ones to boost your mood, even if it has to be virtual. And think about whether someone can accompany you if you feel unsafe anywhere. If that's not possible, try to run necessary errands during daylight hours. If you're worried about discrimination at work, talk to your human resources department. And by all means, don't hesitate to schedule time with a mental health professional if you feel anxious or exhausted. And just keep in mind, whatever your concerns may be as the coronavirus pandemic and the fallout from it continues, do your research so you'll be prepared You'll be prepared to best handle the known and unknown, as well as the different scenarios we may encounter until the situation improves. So, this has been your daily health. Mental health is definitely a part of your daily health. So, take care of yourselves and each other. You have been listening to Daily Health on the On One Radio Talk Show podcast station, where daily health is viewed as an ever-changing reality, which we know it is. If you would like